Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on endocrine, diabetes, and metabolism. Let's get started with question number 7. For the following case, which of the following conversion pathways is most likely deficient in this patient? A. Leucine to acetoacetate. B. Phenylalanine to tyrosine. C. Serine to cysteine. D. Tyrosine to fumarate. E. Valine to glutamic acid. The case scenario is: a 2-year-old boy is brought to the office by his parents. He is currently toilet training during the day and at nighttime. After he urinated in the toilet last night, his parents forgot to flush the toilet and noticed that the boy's urine turned black overnight. The child has no significant past medical history and takes no medications. He can say 2-word sentences, follow 2-step directions, and jump with 2 feet off the ground. Examination shows a well-nourished child with no swelling or tenderness of any joints. Urinalysis shows black in color, specific gravity of 1.02, and no protein with negative glucose, ketone, and leukocyte esterase. The question is, which of the following conversion pathways is most likely deficient in this patient? Your options are: A. Leucine to acetoacetate. B. Phenylalanine to tyrosine. C. Serine to cysteine. D. Tyrosine to fumarate. E. Valine to glutamic acid. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is D, which is tyrosine to fumarate. This question is designed with the focus to assess your ability to apply foundational science concepts. Alkaptonuria is an autosomal recessive disorder of tyrosine metabolism. Deficiency of homogentisic acid dioxygenase blocks homogentisic acid metabolism, preventing the conversion of tyrosine to fumarate. Homogentisic acid accumulates in the body and is excreted in the urine, imparting a black color to the urine if allowed to sit and undergo oxidation. In patients with alkaptonuria, the retained homogentisic acid selectively binds to collagen in connective tissues, tendons, and cartilage. This leads to a blue-black pigmentation called acrinosis, which is most evident in the ears, nose, and cheeks, and acrinotic arthropathy, which typically manifests during adulthood. If you choose any option other than D, you are wrong. Let's briefly discuss the other options. Choice A cannot be the answer because leucine is a branched-chain amino acid that is elevated in maple syrup urine disease. Isoleucine and valine are also increased. Impaired metabolism of these amino acids leads to cerebral edema, seizures, and a sweet smell of the urine. Choice B cannot be the answer because conversion of phenylalanine to tyrosine is defective in phenylketonuria and usually occurs due to a defect in phenylalanine hydroxylase. Undiagnosed and untreated phenylketonuria results in significant intellectual disability not seen in this patient. Choice C cannot be the answer because impaired renal cysteine, a homotomer of cysteine, transport leads to cystinuria, a disease characterized by flank pain, hematuria, and renal stones in childhood or adolescence. Choice E cannot be the answer because sickle cell anemia results from the substitution of valine for glutamic acid due to a single nucleotide polymorphism. This mutation leads to loss of red cell elasticity, polymerization of sickle hemoglobin, and sickling of red blood cells, which results in vaso-occlusive crises. Your take-home message from this question is that alkaptonuria is an autosomal recessive disorder in which the lack of homogentisic acid dioxygenase blocks the metabolism of tyrosine, leading to an accumulation of homogentisic acid. Clinical features include a black urine color when exposed to air, a blue-black pigmentation on the face, and acrinotic arthropathy. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.